Good morning, everyone. As he said, I'm representing the minister. He would have loved to be with us this morning, but his schedule is quite heavy, as we are all aware, and he asked me to represent him for this very important ceremony. So I'm going to read the speech from him. This is not from me, this is from the minister. So I'm doing everything on his behalf. Madam Chairman, it's nice to see you. Acting Head, South Zonal Blood Center, Management of National Blood Service, cherished voluntary blood donors, distinguished award winners, friends from the media, distinguished invited guests, ladies and gentlemen. It is a pleasure to be here today to mark the 2022 World Blood Donor Day celebration. Indeed, Madam Chair, the occasion is worth celebrating because it serves to remind us of the need for safe blood through regular voluntary blood donation. It also affords us the opportunity as a nation to express our appreciation to our voluntary and paid blood donors for their life-saving gift of blood. Madam Chair, ladies and gentlemen, the theme for this year's National Blood Donor Day celebration, donating blood is an act of solidarity, with the slogan, join the effort and save lives. It's most appropriate, particularly at such a time that the world is recovering from such a tragic pandemic, COVID-19. The blood service, we all know, was among the worst affected institutions as far as the COVID pandemic was concerned. And I must personally acknowledge the various efforts management and staff of the blood service made and continue to make in ensuring a continuous safe blood supply despite the difficulties. As a nation, ladies and gentlemen, we must not lose sight of the fact that the safety of blood transfusion continues to be a critical problem in many parts of the world, including Ghana. We are aware that technological advances have led to substantial improvements in industrial countries, but progress in our part of the world has really trailed behind. World Blood Donor Day commemorations like this, therefore, draws our attention to the unavoidable deaths that result from lack of safe blood supply. Certainly, the importance of blood in saving lives of victims in any emergency situation cannot be overemphasized. We have a mandate to save lives, and that must remain our focus. Madam Chair, as we strive to ensure blood safety and blood availability, one of the things that we must guard against to avoid waste and perennial blood shortage is the unnecessary transfusions and unsafe transfusion practices by some of our health providers. Studies have shown that such unnecessary transfusion practices expose patients to the risk of serious adverse transfusion reactions and transfusion transmissible infections. Again, unnecessary transfusion reduce the availability of blood products for patients who really need it. The WHO has recommended development of systems such as hospital transfusion committees and hemovigilance to monitor and improve the safety of transfusion processes. In this regard, I urge management of the National Blood Service to ensure that such a committee is constituted as soon as possible at the 3 zonal zones for the purpose of monitoring and improving services within the hospital blood banks. In all of this, without the contribution of our dedicated voluntary donors, there still will be no blood for patients at the hospitals. So, ladies and gentlemen, kindly join me in saying ayiko to our voluntary donors who have shown their selfless commitment in making sure that safe blood products are made available in our hospital blood banks for patients who need transfusion. So ayiko to our donors, including the ambassador that was introduced earlier. Ayiko. It is time for the blood service to collaborate more with institutions like the NCCE to intensify blood donor education campaigns across the country, especially in our educational institutions, in making sure that the spirit of volunteerism is rekindled towards voluntary blood donation. The campaign must highlight the role of the youth in supporting safe and sufficient blood supplies now and in the future. Though the role of young people in this process is key, I would also like to appeal to every healthy citizen aged 17 to 60 to please give blood, and together let's keep the world beating. Additionally, all ministries, departments, agencies, the media, schools, training institutions, and corporate organizations should either support staff-based or community-based blood donation at least twice in a year to augment blood supply and sustenance all year round. Madam Chairperson, ladies and gentlemen, on this note, I thank you for the opportunity, and let us all go out there and be ambassadors of voluntary blood donation. Thank you all, and may the good Lord bless us all. Thank you.